Doctors often say that more tests mean better health, but what if that's not always true? After age 70, some medical checkups can actually do more harm than good, exposing you to unnecessary stress, false alarms, or even risky treatments. In today's video, we'll uncover 5 health checkups that many seniors should reconsider, and we'll discuss safer, more effective ways to stay healthy, strong, and stress-free. Welcome back to Old Man's Secrets, your trusted channel for science-backed senior health advice. If you're over 60 or caring for an older loved one, this video could save you a lot of unnecessary worry and trips to the doctor. We're all about empowering you with knowledge so you can make informed decisions about your health. Now, it's really important to remember that everybody's different, and this video is for educational purposes only. It is not medical advice. So, before starting, stopping, or skipping any test, please have a conversation with your trusted healthcare provider first. They know your personal health history and can give you the best guidance. With that said, let's get into it. First on our list is the routine PSA test, which stands for prostate-specific antigen. For years, it's been the go-to screening for men to detect prostate cancer early. While it can be beneficial for younger men, the story changes as we get older. After age 70, major health organizations like the U.S. Preventive Services Task Force, or USPSTF, actually recommend against routine PSA screening. Why is that? Well, studies show that in this age group, the test often leads to a high rate of false positives. A false positive is when the test suggests you might have cancer, but you actually don't. This can trigger a cascade of anxiety, followed by more invasive procedures like biopsies, which carry their own risks of infection and discomfort. Furthermore, many prostate cancers found in men over 70 they're so slow, in fact, that they're unlikely to cause any harm during a person's lifetime. Treating these harmless cancers with aggressive methods like surgery or radiation can lead to serious side effects such as incontinence or erectile dysfunction that significantly impact quality of life without actually extending it. So, what's the alternative? Instead of relying on a number from a blood test, focus on having a conversation with your doctor about your overall health, any urinary symptoms you might be experiencing, and your family history. This approach, known as shared decision-making, ensures that any decision to test is based on your individual risk and personal preferences, not just a routine protocol. Coming in at number 2 is routine colonoscopies for those over 75. A colonoscopy is an excellent tool for catching colorectal cancer early, and it's highly recommended for adults starting around age 45. However, the benefits begin to diminish as we age, while the risks increase. For individuals over 75 who have had consistently negative screening results in the past, the American Cancer Society suggests that continuing routine colonoscopies might not be necessary. The preparation for the procedure can be grueling, causing dehydration and electrolyte imbalances, which are particularly risky for older adults. Plus, the procedure itself, while generally safe, carries a small but real risk of complications like bleeding or perforation of the colon. If you have a history of polyps, a family history of colon cancer, or are experiencing new symptoms like unexplained weight loss or changes in bowel habits, your doctor might still recommend a colonoscopy. But for many healthy seniors over 75 with no specific risk factors, the potential harms may outweigh the benefits. Alternative, less invasive screening options like stool-based tests could be a better fit. These tests are easier to perform and can still effectively detect signs of cancer. The key here is, once again, a personalized discussion with your doctor to weigh the pros and cons for your specific situation. Don't just go through the motions of another test without understanding why it is being recommended for you at this stage of life. Number 3 on our list is routine mammograms for women over 75. Similar to the PSA test and colonoscopies, mammograms are a crucial screening tool for breast cancer in younger women. But as women advance into their late 70s and 80s, the balance of benefits and harms shifts. The USPSTF states there isn't enough evidence to assess the pros and cons of screening mammography in women aged 75 and older. Why the uncertainty? Because, like some prostate cancers, Many breast cancers detected in this age group are slow-growing and may never become life-threatening. The stress of a potential cancer diagnosis, follow-up, biopsies, and aggressive treatments, like surgery or radiation, can take a significant toll on an older person's physical and emotional well-being for a cancer that might not have caused any problems. This doesn't mean you should ignore breast health. On the contrary, it's still vital. The best approach is to remain aware of your own body. Continue to perform self-exams and report any new lumps, changes in breast appearance, or nipple discharge to your doctor immediately. Instead of automatic, routine screenings, the decision to have a mammogram should be a collaborative one. Your doctor will consider your overall health, life expectancy, and personal values. Are you healthy and active with a long life expectancy ahead? A mammogram might still make sense. Are you managing multiple chronic conditions? The risks of overdiagnosis and overtreatment might be a greater concern. It's about tailoring healthcare to the individual, not a one-size-fits-all rule. Next up, at number 4, are bone density scans, also known as DEXA scans, for seniors with a low risk of fractures. These scans measure bone mineral density to diagnose osteoporosis, a condition that makes bones weak and brittle. It's a very useful test, especially for postmenopausal women. However, for older adults who have no previous history of fractures, have a healthy lifestyle, and don't have major risk factors like long-term steroid use, frequent scans may lead to overtreatment. Many people diagnosed with mild bone loss or osteopenia are prescribed powerful medications that can have side effects, including rare but serious problems like jawbone decay or atypical femur fractures. For these low-risk individuals, the potential side effects of the medication can be more dangerous than the condition they are meant to treat. So, what should you do instead of rushing for a scan? Focus on prevention. The best way to maintain strong bones is through lifestyle choices. Engage in regular weight-bearing exercises like walking, dancing, or light strength training. Ensure your diet is rich in calcium and vitamin D found in dairy products, leafy greens, and fortified foods. And of course, take steps to prevent falls, like removing trip hazards in your home and wearing sturdy shoes. If you do have significant risk factors, or if you and your doctor decide a scan is appropriate, that's perfectly fine. But for many healthy seniors, building and maintaining bone strength through daily habits is a safer and more effective strategy than relying solely on scans and medication. Finally, number 5 is the routine use of statins for primary prevention in adults over 75. Statins are cholesterol-lowering drugs that are incredibly effective at preventing first-time heart attacks and strokes in middle-aged adults with high cardiovascular risk. But for older adults, especially those over 75 without a history of heart disease, the evidence is much less clear. Some studies suggest the benefits of starting statins this late in life are minimal, while the risks of side effects become more pronounced. These can include muscle pain, fatigue, and an increased risk of developing type 2 diabetes. For an older person, muscle pain and weakness can be particularly debilitating, affecting mobility and increasing the risk of falls, which can lead to a serious decline in health. This is a classic case of primary versus secondary prevention. If you've already had a heart attack or stroke, taking a statin is secondary prevention, and the benefits almost always outweigh the risks, regardless of age. But for primary prevention, preventing that first event in a person over 75, the decision is more complex. It's crucial to have a thorough discussion with your doctor about your overall health and lifestyle. Factors like blood pressure, diet, exercise habits, and whether you smoke are all part of the bigger picture. In some cases, focusing on lifestyle modifications might be a much better strategy than adding another daily pill to your regimen. So there you have it, 5 common medical checkups that may not be necessary and could even be harmful for many people over the age of 70. The main takeaway today is that more testing is always better. As we age, our healthcare needs to become more personalized and focused on our quality of life. The goal is to live not just longer, but better. Always be your own best advocate. Ask questions and work with your doctor to create a health plan that is right for you. Thank you so much for joining us on Old Man Secrets. If you found this information helpful, please give this video a thumbs up and share it with a friend or a family member who might benefit. Do not forget to subscribe and hit that notification bell so you won't miss our next video on practical tips for healthy aging. We love hearing from you, so please leave a comment below with your thoughts or questions. Stay safe, stay informed, and we'll see you in the next one.